I think we can kick this off now. So again, thank you for joining us today. My name is Charles. I'll be moderating this webinar, and we've called it Rebound Your Practice, Safely Increase Your In-Office Visits. And with us today are, first of all, two very special guests, Chrissy Atkins, who is administrator at Ellettsville Dental Center. So thank you, Chrissy, for being with us today. It's very appreciated. And also, we've got Shawnee Ritchie, CFO and COO at Pediatrics and Adolescent Center. We're very grateful for both of you to be there today, and we're looking forward to chat with you a little bit later in a few minutes. We also have John Flores, our own John Flores from Doctible, who's product manager with us and had a very big part to play in developing and working the virtual waiting room, onboarding the folks and making sure everything works well for them. So thank you, John. Also, I know you're a very busy man. So quick overview of what we're going to cover today. First, we're going to look a little bit at the story behind our virtual waiting room. So I'll give you a couple elements here as to how we've got to develop that module and so on and so forth. Also, after that, we're going to take a quick look at how it actually works. So I'm going to spend a few minutes walking you through the cadence of the messages and how it's automated. And we're going to take a quick look at the dashboard as well. And after that, which is going to be our main dish, is going to be the crux of today's session, we're going to open it up to both Chrissy and Shawnee, and they're going to be able to share with us how they've implemented and how they're using the virtual waiting room on a daily basis. So that being said, we're also going to end with a question and answer session. So please, if you have any questions, chat us the questions through Zoom and we'll make sure we cover them. And if you can't stay after when we're doing the Q&A, don't worry, we're also going to email you the answers so you have all the information you need to appraise the virtual waiting room. So that being said, let me give you a little bit of background on the virtual waiting room. So before the pandemic hit, I think we can all agree that we could all project the same mental image of what a waiting room is, right? We could all picture that pretty much the same with some differences. Now, obviously, the pandemic hit us and the COVID-19 situation made it so that a lot of offices had to close. Some of them didn't have to, but definitely had to operate in a different way. And after closing, a lot of offices had to reopen. And a little bit of chaos there, a little bit of changing guidelines. And obviously, some states were hit harder than others, but between the CDC, different state-led guidelines, county guidelines, different medical associations putting out their guidelines to reopen, it was a bit confusing, and there's definitely had to be a better way to go about this. So this is when, because we're in touch with our users, this is when we started to gather a lot of intelligence from folks who had best practices, and we went to work and we thought we could find a better way to do things with the virtual waiting room. So that's what led us to spend a lot of time and resources into coming up with a module that we're going to look at in just a second. To give you a short idea of how the virtual waiting room works, first of all, it's an automated way to pre-screen, guide, and take in your patients before their appointment. So what it does is 24 hours before a patient's appointment, it's going to send them a text with a pre-screening questionnaire. So that's mobile friendly, so the patient can fill it out, obviously on their mobile device, and you get alerted when they fill it out. There's different questions. You can customize that form so it reflects your needs at your practice, but that's automated and that happens 24 hours before their appointment. Now, if everything goes well, 1 hour before the appointment, they also get an automated text message asking them if they have new symptoms and telling them to text us here when you get to the practice, when you get to the parking lot. So you've got the 24 hours before, 1 hour prior to make sure everything's okay. And then when they get to your practice, they actually text you here. Now remember, all of this so far is automated and you don't have to do anything for it to happen. The only thing that you need to do is when they text here, then on your dashboard, which we're going to take a look at in just a second, on your dashboard, you'll be alerted that the patient is in fact here and ready to see you. So you just have to click one button, that triggers a text to the patient, letting them know that you're ready for them to come in and do their appointment. The module also includes a two-way HIPAA compliant texting module because patients might have other questions, they might have something else they want to ask you about. So that way you're able to freely two-way text with them and also use a lot of different templates. So that's in a nutshell what it does. It's an automated and very safe way to get pre-screening and intake management done for your patients every day for the practice. We're going to take a look at the dashboard. Now, again, obviously, if you want to have more of a feel as to how this could impact your practice, we'd be more than happy to talk to you about it. But because we're going to refer to this quite a bit in the next few minutes, I wanted to just make sure you could lay eyes on this dashboard. So it's very simple to read, very intuitive. It's color-coded, so you know exactly which patient is where in their journey prior to their appointment. So it's chronologically ordered with the patient's name, and on the right, as you see, their appointment time and their different steps in their appointment preparation, so that you know at any point in time who's where and who's filled out what, so that when you're ready and you click the little ready button on the right, it triggers that text to them, and it's flawlessly and very safely done to get them in for their appointment. So all that being said, let's now move on to our special guest. I want to welcome again Chrissy Atkins. She's administrator at Ellettsville Dental Center, and she's a Doctible power user. So that means their practice is using multiple different solutions that we offer. So they're using our reputation management, they're using our automated reminders, our two-way texting patient communicator, and our virtual waiting room that we're going to concentrate on today. So thank you, Chrissy, for being with us. We really appreciate it. Looking forward to talking to you. We also have Shawnee Ritchie with us. She is the CFO and COO of Pediatrics and Adolescent Center. Their practice is a Doctible premium user. So that also means they're using many different solutions from Doctible. So reputation management, automated reminders, our patient communicator, which is the two-way texting, the virtual waiting room that we're going to talk about today, but also our email campaigns and missed appointment reminders that are automated. And they, at Pediatrics and Adolescent Center, run through NextGen Office. So thank you again, both, to be there and to share with us. And maybe we can start with Chrissy, just so we can give folks that are listening here some context. Can you please give us a very quick introduction of your practice and describe what you had in place before you onboarded with the virtual waiting room?
Yeah, sure. We're a very busy practice. We have 4 hygienists and 3 doctors here a day. I know before the COVID hit, when a patient got here, we had to close the waiting room. Patients couldn't wait there, so they had to call from the car. So every patient was calling from the car, saying that they were here. We'd have to see what vehicle they were in. When the provider was ready, they'd have to go to the front door and try to motion them to come in, or, call them to tell them to come forward. It was a lot more time consuming. As many patients as we were trying to see spaced out with the social distancing, it was getting quite hectic. But, this really did help us out.
Nice. Thank you for sharing that. And Shawnee, I'm going to turn to you and ask you the same question. If you can give us a little bit of context about your practice and what you had in place before you adopted virtual waiting room.
Perfect. First of all, thank you for having me on today. We are actually a primary care pediatric practice based out of Dallas. Pediatric and Adolescent Center is one part of what we do offer in the Dallas-Fort Worth area. We've been in the area for over 20 years and have been on EHR for about 15. That's kind of really important because as a forward-thinking organization, we were really looking for ways to actively engage patients, especially when it came to being a patient-centered medical home. So that's one of the key components that we wanted to have. As far as the pandemic goes, when Ebola came on a few years ago and H1N1 came on, so we already had some form of calls in place, but nothing as in-depth as what we're really seeing when COVID hit. But fortunately for us, we already had some kind of process in place to really address the surge or non-surge that we were seeing, and just to really address the safety mechanisms that our patients were looking for. So prior to the virtual waiting room, we were literally using forms to address some of the basic things that the virtual waiting room was doing. And we were doing it with the manpower that we had, and whether on site or at home. So we had those mechanisms in place, similar to what Chrissy was talking about. We literally put a banner in place saying we're under protocols when it comes to COVID. And we didn't per se close down the practice as a whole. We adjusted fairly quickly in having to really maintain safety when it came to addressing the concerns that our patients had. And a lot of it really was the symptoms that they were having, and to really catch those asymptomatic patients that were coming in. So what we were missing, and what we didn't know we were missing, was a virtual representation of what we were already doing. So that's kind of when the virtual waiting room came in for us.
Nice. Thank you for sharing that. It's very insightful. Going back to Chrissy for just a minute, can you tell us how are you using the virtual waiting room at your practice, and maybe some of the success you've seen with it, if possible?
Oh, yes. We try to utilize it the best that we can. We hugely make it a difference with the questionnaires going out, because, before we would have to call the patients 2 days before, ask all the questions, then call again the day before, and then ask the questions. And then when they got here, we again had to ask again. It took a lot of manpower just to do the pre-screening questionnaires because of the COVID. But that's being a dental office. We're high on the list of the possible contaminations. So we had a lot that we had to change within our office because of COVID, but not in the back. It was all in the front that we had to change, all the screening questionnaires. But with sending those questionnaires out in advance, patients really responded well to them and were able to complete them more on their time, whether after work or on lunch or at break, rather than us interrupting them to complete those by phone and then having them to call us back. With them getting here and then they marked online that they were here, if we were busy up front, any staff member within the office could log in, see that their patient was here, and go ahead and bring them in to start without us having to notify that the patient was here. So between the back office and the front office, it has really helped our flow tremendously. It's helped cut down on the patient having to call and wait or call and get one of us to tell us that they were here. It just seemed to help all the way around.
Great, that's awesome to hear. And as a reminder, folks in the audience, please feel free to chat any questions you have. We'll make sure to address them as we go through this. So don't be shy. Just send us questions if you have any. And going to Shawnee here next, do you have a way, and maybe it's not hard numbers, but maybe just a feeling of it. Do you have a way that you're measuring the success of the virtual waiting room for your particular practice?
We actually do. I mean, I think a good way to really dive into why it's so impactful to us is just to get a little bit of a background of our organization and who we service. So here in Dallas-Fort Worth area, a total of close to about 8,000, almost 9,000 members that we service a year. And actually 55% of that falls under the Medicaid, which is the uninsured or low income. And then the other percentage of that is commercial payers. So while that's important is because if there are administrators or financial individuals on this call in the medical industry, as you know, why that's critical is because we make a lot of our revenue when it comes to patient coming in is through volume. And so for us to have resources like the Doctible, a two-way communication, and the virtual waiting room is really critical as we look at process flow and as we look at really maximizing our resources internally. To give you an idea, on a day-to-day basis prior to before going to a two-way communication platform, which we've been on a platform for a while, outside of Doctible for about 6 or 7 years now. Prior to that, we were literally receiving 300 to 350 calls a day. And that is a team on site trying to get through those telephone calls. As you know, as a medical practice knows, it's highly improbable to really answer some of those calls. And a lot of them are patients waiting at either 7:59 in the morning to get on an 8 a.m. call just so they can get on a list for the day or even to come in. So as we were really looking for resources to provide it's all about patient engagement and communication. And so when it comes to providing them the quality service that we're being asked to do, we wanted to have a platform like Doctible to really address all of that. So what we're seeing is, and I don't know, John, if we can pull those numbers, but we are literally answering text, two-way communication. My team is running through maybe 200 or 300 texts a day. I mean, even more than that. So they ran some of those numbers for us. The reason that's important for us is because it is a visual representation of the process that we already have in place. And why that's important is because it minimizes the callbacks that Chrissy may have been referring to that my team has to do. It provides as a quick way to know and to triage. So for us at this point, it provides a way to triage our patients when it comes to who are we going to be seeing first based on the symptoms. So one of the things that we did a little bit differently is that as we really looked at the questions that in the health questionnaire, because it was originally a traditional CDC questions that they said, these are the symptoms you should be looking for. We literally took those questions and adjusted it or tweaked it to better help our organization with our process flow. So a good example would be, we talked to John about changing some of those questions to better reflect really what we needed as an organization. One example is, are they running a fever or they're having a hard time breathing? So for us, the moment that we see a red in our system, it automatically triggers our triage team to make sure to be on the lookout for those, and they're automatically reaching out to them. So if, let's say, my daughter is having a wheezing problem and they've been running a fever, I make an appointment, or I send a text to a team or to my pediatric office at 2 a.m. in the morning. They're answering it at 7:30 in the morning with an appointment, let's say an hour later. The system will send an automatic saying, it looks like you have an appointment for an hour later. Please, you can check in now and then fill out the health questionnaire. The moment that we see that red trigger, then my RN and my medical assistants can automatically connect with the parent via text function to just get additional ideas on what is happening with that child. And as they're coming in, when we're seeing kind of red across the board, and when they're saying that they're on site, it then allows my team to prep for their team prior to having them come on board. So the wait time for the patient is literally less than 5 minutes to wait and to get checked in. And for us, that's important because as we took our team through a lean process a few years ago, we really identified how long the patients had to wait. And that's, as you're really looking at quality across the board, you really have to identify some of the things that causes parents angst when it comes to patients' visit. And we wanted to make sure that the wait time, especially at check-in, is less than between 5 to 10 minutes. And the virtual waiting room has really minimized that process. A good example that feedback that I'm hearing is, as soon as a patient checks in and they've kind of seen, and they've seen either green across the board, everything is set. And when they send here, my team already has the room ready, and all they need to do is do a quick temperature check and they're in the room. So that's kind of how we've been using it. And as part of our measure, one of the things that the Doctible platform does is it provides a survey right after that. So we have actually seen our Google reviews increase. And so if there are some marketing people on the call, you kind of know how important those are, because social media is such a big driver of how your revenue will increase in the long run. We have seen our Google reviews really increase when it comes to some of these processes that where we have incorporated Doctible. And so that's kind of one of our initial measure is really seeing how our Google reviews have come up. Our second is the feedback, the quickness that it takes for us to really process the patients through, regardless if we're seeing 30 patients per day, or I think on Friday we saw over 125. So regardless of that, the communication is quicker. We're able to address the issues a lot faster when it comes to the medical part of it. And I think on the patient engagement side, it allows us to really connect with our patients and our parents specifically on the quickness of our responses, and especially and they're very thankful that we have a system in place that really gives us an opportunity to provide care for those that are symptomatic, and also to separate out for those that doesn't, because it helps my team adjust quite quickly when it comes to those situations.
Thank you, Shawnee, for that. That's very helpful. And Chrissy, to feed off of that, do you have any feedback from your patients as far as the patient experience in coming in from the virtual waiting room? Anything came up?
I do know that many of the patients, when we first switched over to this, several of them had always praised, that was so much easier. Thank you. It was better than calling in. So a lot of patients were even picking up on it And then some would say, I wish we had something like that at our work. I wish we had something like that instead of getting the patient in a parking lot. That was even from some of the nurses that are nearby. I think it's just something to help the patient, make it easier for the transaction, for them to be where they can feel safe in the car, where they can feel safe away as distant as possible from other people during this time. You know, we were seeing many of them that just had reacted very well to it. We were getting more people responding to the Doctible platform than what we were getting by the phone.
That's always good to increase that patient satisfaction for sure. John, I think we have a question here if you want to jump in real quick and field it, please.
Yeah, so there's a couple of questions that have come in. The first one being, besides the COVID consent questions, can we add our own consent forms being texted out with the aforementioned questions?
Can I answer that, John?
Yeah.
Okay. I'm like, can I answer that question? It's funny because this is one of those things that John and I really go back and forth when it comes, because one of the things that we have to have is a COVID consent every time. And so it was one of those things that was kind of hypercritical for our organization to have, because as we all know, there are legal stuff that we have to have in place outside of the kind of nice to have kind of a thing, right? So what we've done, we're working on some of those things, and that's kind of one of the beauties of the Doctible virtual waiting room is that we are able to adjust some of those questions to us. As far as the COVID consent, we are looking for ways to really incorporate that in there, but we've kind of found a different way to do that from our organization. I would be more than happy to share that with you, because what we've done is we've literally turned our organization versus in kind of an urgent care organization, meaning that every question is really critical when it comes to the legal aspect of it, because there is a lot of liability issues when it comes to COVID, especially now for a lot of medical practices. And so what we've done is what we've really worked with is they're able to adjust and tweak the way that the communication is being sent to the patient. So a good example is the moment that we have a patient scheduled in our EHR, an email is sent out to the patient saying, this is just a reminder, please reply to your appointment. As a reminder, here are either pre-registration questions or you can check in 24 hours prior. So in that specific link, we have our all of that we're going to need specifically for the patient prior to their appointment coming to us. So we can get that within 24 hours or within 48. And so the way we have set up our system is a reminder goes out, I believe, within 72 and then 48 and 24 hours, and even an hour before. So an hour before, if you've not used the Doctible system, an hour before the appointment, it does prompt the patient to remind them of their appointment. Plus it gives a Google map on how long it's going to take them to get to the practice. So even if they haven't filled out all the forms yet, they have that specific hour to be able to make that happen. So we're able to do that, just to kind of answer your question, but that is kind of one thing that as we were really looking at changing some of the questions on Doctible itself, on the questionnaire, we were trying to find a way to really incorporate a ton of our process flow in it. And so because there's so much legal stuff that has to happen and has to be signed, we have found a better way to do that in our case. And that is really incorporate a specific link within the reminders of the patients. And I'd be more than happy to share with you guys how we do that organizationally. It's something that can be absolutely replicated as quickly as in 24, 48 hours. So, Sorry, John, I just absolutely that for you.
Yeah, shortest answer is yes, it's possible, right? So I think that's, Shawnee gave a wonderful explanation as well. We did have another question from Caroline. She asked how many patients do not reply and just walk in. And I can just kind of touch on that. So statistically, we're seeing about 80% of patients are completing the surveys, whether it be from a first message or from a reminder. And then we're seeing, again, about 65% of those patients are replying here to their request to come inside of the office. So we're seeing a high interaction rate. So there's not very many patients that are just walking right into the office. I mean, patients do like to, at least from a product perspective, we've noticed that patients do like to quickly follow instructions that they're given from the text messages.
I know on our end of things, at our office, we see pediatric all the way up to elderly. Most of our patients will react this way. The only ones that really come to the door and try to come in are the elderly who still does not have a cell phone. I know that most of all of our patients either call from the parking lot or reply to Doctible. Ours, like I said, is just those that do not have a cell phone and come to the door to try to come in.
So from our perspective, Carolyn, we do, patients try to walk in, but what it does is it really helps when you have like a big banner that says, please stay in your car. Or, so what we have is please stay in your car, a text, and the number that we gave them here when you're here, or assist if you have a question. And what that does is it gives our team on the ground an opportunity to address any of those concerns, especially now especially for back to school, and you have a lot of parents trying to pick up shot records, et cetera, and things like that. You do have some of those, and it is answered by it. So what's really great is if you have a Doctible system, they're able to really communicate with you in a contactless way, but still have a person at the end of the line to just kind of really provide that empathy that they really need to address some of their concerns.
Mm-hmm.
Nice. Yeah, that's very interesting. And maybe in conclusion, I'll open it both to Chrissy and Shawnee, to both of you. We don't know what the future holds, right, at this point in the next few months, and especially not in the next couple of years, but have you put some thought into how you're going to use the virtual waiting room in the future, and how does that look like for your practice, please?
I know for our end, I don't believe we've kind of went that far, but from what I've spoke with the doctor, I do think this will become more of the norm. I think that it'll probably keep continuing to have them waiting in their car and doing the virtual waiting room even after all of this has succeeded, because there's always the flu season. There's always, colds. There's always other parameters to kind of think about, but, time will tell.
So from our perspective, we are actually not looking at this as a short-term solution, only because we feel that as an organization, especially with kind of what a lot of organizations went through in the last quarter, we're really pretty mindful about the resources that we invest in. And so as we looked at the virtual waiting room as an investment, looked at it as an opportunity to just really look at our process flow to see how we can incorporate it for the future to better be a patient-centered medical home for our practice. So, and we've already started doing that, because one of the things that we did, like I said prior, is we tweaked the questionnaire specifically to address the concerns of COVID-19, as well as address the concerns that our physicians may have when it comes to triaging, and how to better address some of the situations that's coming in office for us. So for us, the virtual waiting room is part of our current process flow today and in the future. So as Chrissy did mention, we are getting ready for flu season, and as well as future issues that come on board when it comes to the medical industry. But what the virtual waiting room does for us, it provides a piece of the puzzle as we really look at how we set up and design the practice of the future, right? Because we cannot, as an organization, stay with what we've already done in the past. We really have to kind of move forward 5 years to where we see it's gonna go. And in a lot of cases, practices had to shutter their doors because they didn't invest in resources like something like you're seeing in two-way communications, what you're seeing in the virtual waiting room, as they're really trying to redesign what the practice of the future looks like. So from our perspective, it's not just a COVID resource for us. It's actually part of our process flow that's already in place for our organization, and we're continually tweaking. So at least for us and the urgent care that we're going to be launching in about 30 days, it's going to be an integral part of how we really address the issues that come when it comes to patient engagement, when it comes to patient communication, and especially how we provide quality and quality care, and still be able to do that with while maximizing our resources.
Great.
Yeah, it looks like we have another question, Charles, coming from Chelsea. Are we able to text our patients through this platform, and what do you have available for virtual visits? Is there a platform for virtual visits?
So Chelsea, yes, so we are able, so it's a two-way communication platform, meaning that we're able to absolutely text our patients back. So the example I started earlier this morning is that if a mom is up, let's say at 6 a.m. in the morning and needed an appointment at 8 a.m., they're able to text at 6 a.m. and my team is able to log on at 7:30 just address it. So that's kind of one of the things I did want to mention. As COVID hit and you're seeing a lot of these organizations really travel and work from home, right? One of the things that, I'm hoping that a lot of practices are doing is that they're looking for ways to really have a mobile workforce. Because that's one of the things that as an organization, we made sure that we had 4 years ago. And so, meaning that as an administrator, one of the things that I look at every day is to making sure that the team I have is maximized to the fullest. Because as we know, that the highest expense any business has is your employees. So what we've done is we've able to literally either get part-time employees to work from home and able to log on at specific times during the day to really address some of these messages. So now my time frame to address my patients is not really from 8 to 5. I can literally get and track patients coming in at 7:30 if they need an 8 o'clock appointment. And so they're able to communicate in real time to get that appointment in real time. And then when it comes to the virtual visits, our EHR, and a lot of EHR should be able to provide a platform for that. We use NextGen, and that's they have their own EHR platform that's included in that. And it's basically we're able to really put the process flow together when it comes to Doctible and our virtual visits. So it's been really helpful in that case when it comes to finding those types of resources. So we are able to do it to text these patients and parents in real time.
I know for our office, since we're dental, we can't do virtual visits really, but the texting back and forth, the two-way communication, that's been fantastic. We're here in Indiana. We have bad weather that comes in, inclement weather. There's been a few times that the office has had to close, and we've been able just to text all the patients that the office had to close due to the weather that had come in. So that was also nice. I know it's not about the virtual waiting room, but it is about the Doctible and the virtual the texting back and forth. So that was also a selling point for us as well.
So can I just mention one thing that I know that we're talking about two-way communication. So one of the things that we don't mention here in this call, because I know it's about virtual waiting rooms, if you've not used Doctible in the past, they also provide a marketing platform, meaning that if you're looking for newsletters to kind of send out to your patients, that's available here as well. It's called campaigns within their platform. And why that's important is because as medical practices know, or even just healthcare organizations, you just have to have some kind of marketing platform to really address that. And not only does it do two-way communication, campaigns, and marketing, it does also provide reputation management when it comes to the survey. So it does tie directly in your Google page on the internet. It is so much more than a texting platform. And it starts off with that, but the beauty of the system is it's so much more, and practices can use bits and pieces of what they offer. But at the end of the day, you really need to look at if you're going to invest, and I hammer on that because it's a cost issue that we're really all looking as an industry. That if you're going to invest in some kind of two-way communication and patient engagement platform, truly look at the patient engagement platform that you're using, because there's so many out there. And Doctible, their virtual waiting room is just a piece of the puzzle that they do offer when it comes to that engagement platform. But there's so much more to it. So I just kind of want to mention that because I know that didn't come up on the call, but I know it's a critical piece that we do all the time. At least so we provide our patients information on closings that Chrissy was talking about, and or we have the flu vaccine, or when we have COVID testing. So it's a lot of those things that the patients really look at because they're not opening up their mails, they're for sure opening up emails, and they're replying to their text. So that's kind of what we have. Sorry, John, I just had to talk about all of your things that you guys offer.
That's good. Thank you for explaining that, me and Chrissy. Any other questions from our participants, from our attendees here? Anything else we can field for you folks today? If not, we're going to go ahead and thank you all for your time here. We know how busy days get, and we know how you're solicited every minute to get things done, but have spent a bit of time with us today is great, so thank you for that. Also, if you want to see how the virtual waiting room or perhaps other solutions from Doctible might be of help to your practice, don't hesitate to let us know. We'll be more than happy to have one of our consultants get in touch with you, learn a little bit more about your practice, and see if this is something that would make sense to implement in your particular case. So again, Chrissy, Shawnee, thank you so much for your time and your insight. It's been great to have you today. John, thank you for your time as well and been very helpful with the questions. So that's it for us, folks. It's a wrap. So we'll get you keeping going on your day, and hopefully we'll talk to you very, very soon. Have a great day.
Thank you.